Department of Health is the executive department of the government of the Philippines. This is responsible for ensuring access to basic public health services by all Filipinos through the provision of quality health care, the regulation of all health services and products. VOH has its vision. These are to make the Filipinos are among the healthiest people in Southeast Asia by 2022 and Asia by 2040. This also has its mission, which is to lead the country in the development of a productive, resilient, equitable, and people-centered health system for universal health care.
June 23, 1898, through the proclamation of President Emilio Aguinaldo, is the creation of the Department of Public Works, Education and Hygiene, the Department of Public Works and Highways, Department of Education, Culture and Sports, and Department of Health, respectively. On September 10, 1898, Americans assembled a military board of health. On September 29, 1898, a military board of health was first established. Dr. Frank S. Burns is given the position of president, and Dr. C. L. Mullins is given the position of assistant surgeon. The goal of this board of health was to provide medical attention for hurt American soldiers, but as hostilities between Americans and Filipinos subsided in 1901, it was decided that a civilian board of health would be more appropriate, with Dr. L. M. Moss serving as its first health commissioner.
During 1899 to 1905 is the abolition of Board of Health and the appointment of Dr. Guy L.D. as the first Commissioner of Public Health, such as the Act No. 157 of the Philippine Commission, Act No. 307, 308, and 309, and also the Act No. 1407, also known as the Reorganizational Act. Under Act No. 307, 308, and 309 is the establishment of the Provincial and Municipal Board of Health, completing the health organization in accordance with territorial division of the island. Meanwhile, Act No. 157 of the Philippine Commission is the creation of the Board of Health for the Philippine Island. It also acted as the Board of Health for the city of Manila. And lastly, the Act No. 1407, also known as the Reorganizational Act, is the abolition of the Board of Health and its function, and the activities were taken over the Bureau of Health. In 1906, passage of Act No. 1487 of the Philippine Commission, repealing Act No. 307, wherein the Provincial Board of Health gave way to the office of the District Health Officer.
1915. It was the year when the Bureau of Health changed its name to Philippine Health Service, which was later on changed again to its former name. 1932 is the passage of Act No. 4007, also known as the Reorganization Act of 1932, which created the Office of the Commissioner of Health and Public Welfare, the Philippine General Hospital, and the 5 examining boards such as medical, pharmaceutical, dental, optical, and nursing. January 1, 1941, creation of the Department of Health and Public Welfare as provided for in Executive Order No. 317, Series of 1941. The department was under the Secretary of Health and Public Welfare and also included the Bureau of Quarantine, the Health Department of Chartered Cities, the provincial, city, and municipal hospitals, dispensaries and clinics, the public markets and slaughterhouses, the health resorts, and all charitable and relief agencies. However, the Philippine General Hospital was detached from the department and transferred to the Office of the President of the Philippines.
In 1947, Reorganization of government offices under Executive Order No. 94, Series of 1947, with the transfer of the Bureau of Public Welfare to the Office of the President, and the department was renamed Department of Health or DOH. In 1950, under Executive Order No. 392, 1950, the Department of Health gained additional functions brought about by the transfer of the Institute of Nutrition, together with the Division of Biological Research and the Division of Food Technology from the Institute of Sciences, and the public schools, medical and dental services from the Office of the President of the Philippines and the Bureau of Public School respectively to the DOH. Within the Department of Health, certain changes were also affected through the transfer of the Division of Health Education and Information from the Bureau of Health to the department proper, in exchange for which the Drug Inspection Division was transferred to the former office of the latter. The conversion of the section of tuberculosis into a division of tuberculosis, directly under the office of the Secretary, and the conversion of the Division of Laboratories into an office of the Public Health Research Laboratory. In 1958, the creation of 8 regional health offices and the 2 undersecretaries of health, which is the undersecretaries of health and the medical services and the undersecretary of special services. In 1971, the creation of the Food and Drug Administration, Bureau of Disease Intelligence Center, Malaria Eradication Service, Bureau of Dental Health Service, National Comprehensive Maternal and Child Health or Family Planning Program, National Nutrition Program, and the National Schistosomiasis Control Commission, among others.
And then in 1971 is where the time where the creation of the Food and Drug Administration, Bureau of Disease Intelligence Center, Malaria Eradication Service, Bureau of Dental Health Service, the National Comprehensive Maternal and Child Health or Family Planning Program, National Nutrition Program, and the National Schistosomiasis Control Commission, among others. Then in 1972, through Letter of Implementation No. 8, pursuant to Presidential Decree No. 1, September 24, 1972, where the DOH was renamed Ministry of Health. And then in 1986, the Ministry of Health became Department of Health again.
1987, another reorganization under Executive Order No. 119, which placed under the Secretary of Health 5 offices headed by an Undersecretary and an Assistant Secretary. 1992, full implementation of Republic Act No. 7160 or Local Government Code. The DOH changed its role from one of implementation to one of governance. Significant change branching out of the Office of the Public Health Services to form the Office for Special Concerns. 1999, the functions and operations of the DOH was directed to become consistent with the provisions of Administrative Code 1987 and Republic Act 7160 through Executive Order 102. The Health Sector Reform Agenda of the Philippines 1999 to 2004 was launched.
In the year 2000, marked the institutionalization of the Health Sector Reform Agenda, or the SHRA. The SHRA was endorsed for approval and support by the national government agencies, national and local stakeholders in health, and partners in the international community. The Department of Health institutionalized the Health Sector Reform Agenda, or the SHRA, in year 2000. The objective stated is to improve the way healthcare is delivered, regulated, and financed. This reform was to ensure that the stabilization of unified management and made more efficient of ensuring steady and better service. In July 13, 2001, Administrative Order 37, which contained the guidelines on the operationalization of the SHRA implementation plan was signed by Secretary Manuel Dayrit. It was Secretary Manuel Dayrit that signed the implementation of SHRA guideline of DOH. That health sector reform deals with sustainability in the provision of health care, defining the priorities, refining the policies, and reforming the institutions through which policies are implemented. In year 2003, the One Script Systems Improvement Program was established, Administrative Order 50, Series of 2003, to orchestrate unity, synchronicity, and focused targeting of priority public health programs that would provide the biggest impact to attaining equity, efficiency, access, and quality healthcare in the country. The focus of One Script System towards improving the health of the Filipinos is to improve the country's health status and provide a unique perspective and authority for this analysis.
In 2006, DOH also topped in the Pulse Asia third quarter survey as the #1 government agency in terms of overall performance. Visual Filipinos are among the healthiest people in Southeast Asia by 2022 and Asia by 2040 mission to lead the country in the development of a productive, resilient, equitable, and people-centered health system. And in 2007, one-stop shop licensure system for hospitals sector-wide development approach for health. Meanwhile, in 2008, maternal, neonatal, and child health and nutrition strategy or MNCHN Universal Accessible, Cheaper, and Quality Medicine Act of 2008.
In year 2010, universal health coverage as the new platform on health. In year 2011, Framework on the Health Sector Response to Terrorism, National Policy on Climate Change Adaptation for the Health Sector. And in 2012, Syntax Reform Law, Responsible Parenthood, and Reproductive Health Act.
In 2013, the Food Safety Act and Malaria Elimination Hubs were launched, which requires food business operators to ensure that food satisfies the requirements of food law relevant to their activities in the food supply chain and that control systems are in place to prevent, eliminate, or reduce risk to consumers. The Malaria Elimination Hubs was implemented to eradicate malaria by 2020. Out of 53 endemic provinces, the following 27 provinces declared malaria-free in 2012 maintained their status in 2013. In 2014, the Aquino Health Agenda, or AHA, is achieving universal health care for all Filipinos, or Kalusugang Pangkalahatan, also known as KP, that is implemented from 2010 to 2016. The AHA has three main goals. So the first is to sustain the health financing. Second, responsive health system. And the third one is to have a better health outcome. In 2015, the Regional Office 5 launched the Kalusugang Pangkalahatan High Impact 5, also known as High 5, through a motorcade, summit, and the health caravan. The High 5 aims to fast-track the provision of improved access to healthcare services in the region. High Impact 5 is a systematized strategic approach of the Department of Health that aims to produce the greatest improvement in health outcomes and the highest impact on the priority, vulnerable population within the next 12 months. Tangible outputs are expected to be felt through a nationwide, synchronized implementation of activities.
In December 17, 2016, the Health Secretary Pauline Jean Rizal Bial announced that in 2017, the government will start paying the hospital bills and medicines of poor Filipinos. She also said the Department of Health is capable of taking care of the hospital bills and medicines of poor Filipinos owing to its bigger budget starting in 2017.